Hey, Live Active community, it's Dr. Ahmed here with Live Active Primary Care. This is the part 3 of 7 series where we're talking about the 7 ways to improve health outcomes. We're talking about realigning health insurance, and there's going to be 3 components to this video. Number 1 is going to be defining what we mean when we say realign health insurance. Number 2 is going to be when health insurance should not be involved in our care or our services. It doesn't make sense. And then number 3 is going to be when health insurance should be involved and what role it should play. So when we're talking about realigning health insurance, what we're talking about is the way we treat health insurance, the way health insurance should be involved in our health care. And the best way I can explain it to people is to think about our car insurance, how we utilize car insurance. When we're going out to get a tank of gas, changing our tires, getting an oil change, these are maintenance items for our cars so that catastrophic issues may not come down the road, right? And so we follow the guidelines so that we can maintain our car's value, maintain that car, increase its longevity, etc. Same way when we talk about health. Well, primary care is that bread and butter. It's that maintenance plan. And it's that first stop where if there are any issues, we can identify them. And sometimes, yes, there's labs, there's imaging, but a lot of time it's just talking, getting to know one another. And that's what primary care is about. It's a very special place. It's a very unique interaction. It should be. And if you're not experiencing primary care that way, I think that's a problem, because it's a beautiful thing when you start to build a relationship with a patient, get to know their story. And it takes time, like I said in the previous videos. It takes time to build that relationship, to learn about each other's life story. Well, when primary care can handle 80% of our healthcare needs, health insurance doesn't need to be part of that conversation, doesn't need to play a role. The customer is you. You're out there going to find the best place to get gas for the car, or the best place to get an oil change, place where you trust. So you're the customer when it comes to healthcare. You know, you should find a primary care service and a team that you have a relationship with, you feel comfortable with, it's your go-to, you have access to them, and maybe you have some affordability, right? They do things to help you reduce your costs. And so those are important factors, and that's where health insurance really should not play a role when it comes to primary care. And so as I've talked about in the previous videos, when you're seeing 30 patients a day or 25 patients a day, not only is it leading to physician burnout, but patients are getting only 10 to 15 minutes with their primary care provider, which is leading to a lot of triaging and unnecessary consultations or items being missed. You just can't have a conversation in that less of a time when there's so much to talk about. And so that's what we mean when we say primary care can handle majority of our healthcare needs. What we're saying is health insurance should not be involved in the primary care side of it, because number 1, it's so important. It takes a lot of time, and we need to be accessible. We need to reduce the cost of it. We need to think creatively to reduce those barriers, and that it's too much for health insurance to handle, quite honestly. It's too much for them, too complex for them. So they really need to get out of that game. But when health insurance should be involved would be specialty care, chemotherapy, expensive medications like that, hospitalizations. It makes sense. We get it. That's a high cost care. Then health insurance should be involved. Primary care does not cost a lot to deliver, and it should not be so expensive or networks or so difficult to access it. And so that's what we mean by we really need to think hard about how we view health insurance and how we utilize health insurance in this country. So again, many of my patients will share with me that, and the majority of them have health insurance, by the way, but they will say that the accessibility is so important to them. Not only does it expedite their care, but so many things have been prevented because we have the access, and we don't have to rely on health insurance to get in the way, because they'll do prior authorizations, there's delays of care. It just complicates the whole patient-physician interaction when we simply don't have time for that in primary care. I mean, we need to get things done. If it's abdominal pain, chest pain, whatever it is, we need to avoid ER visits. We need to avoid unnecessary testing. And when you have a relationship with patients, direct relationship, not, the customer is you, not your health insurance. It's a different relationship, and where we can figure out what's urgent or emergent and what's not. Maybe that's this reflux that you're having, you know, but when you call an on-call physician, or a physician that you don't have a relationship with, they don't know you, the safest thing to say is, well, go to the ER because I don't know. This chest pain could be cardiac. Whereas if you have a relationship, they know your history, they know which, they'll be able to say, oh, no, that's not chest pain. So, again, relationships matter. We're talking about realigning health insurance. The way we use it has to be different. It's got to change in order for us to all improve our health outcomes as a country. So, get out there, live active in your relationships, financially, and health. And God bless. Thank you for listening. And please like this video and subscribe to it.